Santosh Prabhu. We are both neuro and spine surgeons at WINS Hospitals, Kolhapur. And today, in this today's live session, we are here to talk about a problem that all of us have faced at some point in our lives: headaches. Now, a headache is one of the commonest medical problems, and when everybody gets it at some point every few weeks or so, and popping a painkiller is what we usually choose to do for these. Now, while that form of therapy might be okay for the occasional office headaches, um, we should not ignore if there is a recurring headache, and because this may be the body's way of telling us of an underlying brain problem. This was recently in the limelight when spiritual leader Sadhguru ignored a headache for weeks at an end because of his busy work schedule. As the headaches got worse, he consulted a neurosurgeon, and an MRI of the brain done showed bleeding between the layers of the brain and skull. This bleeding had been collecting over many weeks, and due to his hectic lifestyle, he had chosen to ignore it by taking a lot of medications for it. Despite getting the diagnosis, he still did not act on it because he had some commitments to fulfill. Maybe he was hoping to overcome it with some spirituality. Then, 2 days later, while at a conclave in Delhi, he had to be rushed to the hospital with drowsiness and weakness of his left leg, and an emergency surgery of the brain was carried out on him. Thank his stars that he recovered well. The operation was a complete success, and he was discharged home after a few days. But not all of us might be so lucky. So we cannot ignore what our body is trying to tell us. Now let us learn about some common types of headaches. More than 95% headaches are usually benign and do not have a underlying cause. These are called primary headaches. Now, the two commonest type of primary headaches are tension headaches, which is a band-like sensation around the forehead. This we commonly experience after a hard day's work, a stressful work day, dehydration, lack of sleep, etc., etc. And this is usually treated by over-the-counter medications. The second type of primary headache, which is common, is migraines. Now, migraine sufferers know that the pain is intolerable when it comes. But at the same time, we should understand that this does not point to a serious condition of the brain. There are good migraine treatments available. Now, a migraine is usually caused by certain triggers like intense sunlight, lack of sleep, stress, smoke, alcohol, etc. And trigger avoidance and good medications can cause migraine cases to go into complete remission. The other two types of primary headaches are a headache due to a cold and headache due to a change in prescription classes. All these are not too serious, and medications lead to very good results for these. Now, the remaining 5% headaches are very serious. These are called secondary headaches because these headaches are a sign from our body to us, trying to tell us that there are that there is an underlying problem, and the body is trying to bring attention to it. Now, these cannot be ignored, and early diagnosis and treatment of these is crucial to avoid bad outcomes later. Now, I would invite Dr. Prabhu to explain about how to identify the signs of these headaches. Over to you, Professor Prabhu.
Yeah, see, these secondary headaches usually indicate that there is something inside the brain which is responsible for these headaches. मतलब कोई अंदर ब्रेन के अंदर या सर के अंदर कोई प्रॉब्लम होती है जिसकी वजह से ये हेडेक्स होते रहते हैं, एंड वो उस बीमारी का बेसिकली सिम्टम होता है. सो व्हाट आर दीज कंडीशंस व्हिच कॉज दीज हेडेक्स? यू कुड हार्बर ए ब्रेन ट्यूमर, अंदर एक आधा गांठ हो सकती है, ट्यूमर हो सकता है. इट कुड बी बिकॉज ऑफ इंक्रीज इन फ्लूइड इन द ब्रेन विच इज कॉल्ड एज हाइड्रोसेफेलस. ब्रेन में अगर इन्फेक्शन होती है, मेनिंजाइटिस होता है, या कोई ब्रेन में एब्सेस फॉर्म हो जाता है, दैट कैन ऑल्सो कॉज हेडेक्स. समटाइम्स ब्लीडिंग इनसाइड द ब्रेन कैन कॉज सडन हेडेक्स एंड इट कैनॉट बी इग्नोर्ड. Finally, in individuals whose blood pressure has shot up to a very dangerous level, a headache can occur. तो हर हेडेक कोई सिंपल नहीं होता है. इट कैन बी ए व्हाट वी कॉल एज अ सिनिस्टर हेडेक, इंडिकेटिंग कि अंदर कुछ गड़बड़ है. जैसे कि स्पिरिचुअल लीडर सदगुरु जी के बारे में हुआ था. उन्हें भी लगा कि कुछ नहीं है, मैं अपनी स्पिरिचुअलिटी का इस्तेमाल करके इसके ऊपर काबू पाऊंगा, मगर वैसा नहीं हुआ. उनकी कंडीशन बिगड़ने लग गई, हाथ पैर की ताकत कम हो गई, उनके होश धीरे धीरे कम हो गए. Now, how do you identify these headaches? These are called as red flag symptoms. तो कैसे आपको पता चले कि मेरे को जो हेडेक हो रहा है, क्या इसके लिए कोई सीरियस कारण हो सकता है? तो उसके जो अकम्पनिंग फीचर्स है उससे पता चलता है. जैसे कि headaches on awakening in the morning associated with vomiting. The specific thing about this vomiting is there is no nausea with it. उसके साथ आपको दिल ऐसे मचलेगा नहीं, अपने आप से उल्टी हो जाएगी. So a headache with vomiting is an important indicator that something may be wrong in your brain. The other thing is headache which occurs in elderly individuals. People above 50 or 55 start getting headaches for the first time. It is more likely to be a secondary headache than a migrainous or a benign kind of headache. तो इसका ख्याल आप उन्हें रखना चाहिए. साथ ही में अगर किसी को दिखने में तकलीफ हो, या तो ब्लरिंग हो जाए, आंखों के सामने अंधेरा जैसा छा जाए, या डबल दिखने लग जाए, जिसे हम लोग डिप्लोपिया बोलते हैं, वो भी होता है, तो ये हेडेक सीरियस हो सकता है. साथ ही में अगर जबान लड़खड़ाने लग जाए, होशो हवास कम होने लग जाए, या कोई कंफ्यूजन पैदा हो जाए हेडेक के साथ में, तो दैट कैन ऑल्सो इंडिकेट अ सीरियस प्रॉब्लम. एंड फाइनली अगर किसी के हाथ में या पैर में तकलीफ, वीकनेस होना शुरू हो जाए, ऐसे हाथ नीचे गिरना शुरू हो जाए, एक साइड वीक होनी शुरू हो जाए, तो डेफिनेटली देयर इज ए प्रॉब्लम इन द ब्रेन. सो दीज आर द रेड फ्लैग्स ऑफ headaches and should not be ignored, because they can lead to very serious side effects, and treatment if delayed can even cost the patient his life.
Now there are a few questions from the audience. Mr. Abhinav has asked, how can stress management techniques help in preventing or managing headaches? I would like to answer that. Stress is a very important contributing factor for headaches. आज की जो हेक्टिक लाइफस्टाइल है उसमें स्ट्रेस सबको होता है, और इसके वजह से हेडेक, जो मैं बोल रहा था प्राइमरी हेडेक, ये सबने एक्सपीरियंस किया है. उसके लिए काफी लोग मतलब हम गोली खाते रहते हैं, एंड दैट इज ओके इफ इट इज वंस इन अ व्हाइल, बट अगर चलते रहे तो वी हैव टू गेट ट्रीटमेंट फॉर इट. वन ऑफ द इम्पोर्टेंट थिंग्स इज स्ट्रेस रिडक्शन. जो कॉज है उसको रिड्यूस करना है. बेटर स्लीप बैलेंस, yoga and meditation definitely help to reduce the stress. So I cannot stress enough about these factors to reduce them, to have a better to control your headaches. Now there is another question. Do all secondary headaches need surgery? Would you like to answer that?
Not necessarily, but all secondary headaches require to be investigated. किस वजह से हो रहा है इसको ढूंढना पड़ेगा. अक्सर द कॉज इज समथिंग सीरियस, एंड इट कुड बी अ ब्रेन ट्यूमर लाइक आई टोल्ड यू. और एक चीज होती है कॉल्ड एज अ थंडर क्लैप हेडेक. मतलब सडनली हेडेक, अभी मैं अच्छा हूं, 2 मिनट में मेरा सर इतने दुखने लग जाता है, इतना उसमें दर्द शुरू हो जाता है कि कहने के, इट्स अ वर्स्ट हेडेक ऑफ योर लाइफ टाइम. इसको थंडर क्लैप हेडेक बोलते हैं. Then it can indicate a rupture of an aneurysm or a balloon on the blood vessel of the brain. So इस किस्म से बहुत सारी conditions सर्जिकल होती है, और कुछ कंडीशंस नॉन सर्जिकल भी हो सकती है. मगर क्या है इसका करेक्ट डायग्नोसिस, सीटी स्कैन, एमआरआई करके only the expert neurosurgeon can do. That's why you need to visit a doctor and not keep on taking medicines from your local chemist. headache का गोली दे दो, headache का गोली दे दो. That is one of the reasons why the tumors which were small and easily treatable become big and difficult to treat.
Mr. Biraj has asked, for those who experience frequent headaches, what treatment options are available beyond pain relievers? So this is, I would just like to give you an overview of this. There are very good options available. First of all is diagnosis of the headache. हमने बस आपको दो चार टाइप के हेडेक बताए. There are at least 20 to 30 different types of headaches, all which are slightly different. So getting diagnosed from a qualified specialist is the first step. Now, if it is a migraine, there are excellent avoidance techniques available. Trigger migraine is always due to a trigger, so you have to identify your triggers. Keep a headache diary so that you can identify patterns, what has caused the headache. और एक बार trigger identify हो जाए तो trigger avoid कर सकते हैं. Another thing is there are excellent medications available for treatment of migraine itself, which will be prescribed to you as per the characteristic of your pain. Mr. Kiran Kumbhar has asked, does a change in specs number affect headache?
Yes. A headache because of wrong spectacles, incorrect correction of the refractive error can produce headaches. But ये headache जो रहता है वो अक्सर it happens in the later part of the day. आपने चश्मा लगा के कुछ समय तक काम किया तो the headache increases. Whereas the serious headaches usually occur when you wake up in the morning. So yes, wrong spectacles can give you a headache.
Mrs. Geetani विचारलाय, झोपेत डोकं दुखलं असेल तर काय? So early morning headaches.
झोपेत डोकं दुखणं म्हणजे if a headache awakens you from a sleep, आप सो रहे हैं और आपको headache की वजह से आपकी नींद उड़ जाती है, तो definitely there is a serious cause for this headache and you need to get investigated.
Mr. Arshit has asked, how do we know that a headache is serious? Usually it is, again I say, if there is a headache that is frequent enough, it is a new onset or there is a change in type of the headache, it is best to go to a specialist and get it diagnosed. It is very difficult to diagnose a headache, whether it has a serious underlying cause or not, based on the severity. As I said, migraines are horrible for people who have it. There must be many migraine sufferers listening to this, and they know how it can just affect their work-life balance completely. But at the same time, they do not point to an underlying sinister cause. So it is a very fine balance, which your doctor would probably guide you to the right path. Mr. Sarvesh has asked, does diet or dehydration play a role in headaches? Are there specific foods or drinks that can trigger them?
Yes, definitely. If you get dehydrated, the migrainous headaches can be triggered by hunger, not taking food on time, certain food items such as cheese, chocolates, Chinese food which contains monosodium glutamate. All these are red wine. These are all known to be triggers for migraine. मगर हर individual में trigger अलग अलग होता है and he has to identify. जैसे आपने चीज़ खाया और आपको headache हो गई, हर टाइम आप चीज़ खाते हैं तो आपकी headache शुरू हो जाती है, तो for you it is easy to identify. When the patients come to us, we do inquire in the history कि भाई आपने ये खाया वो खाया, ऐसे कुछ आइटम की वजह से आपको होता है क्या? And if so, the simplest way is to avoid that.
Though that is simple to say, I think it is a headache to avoid triggers of headache. Now, there is one more question that I would like to answer. There is something called medication overuse headache. Many people are used to taking paracetamol or other over-the-counter medications frequently, almost daily, to weeks at an end. Now, इसमें कभी-कभी क्या होता है, जब हम गोलियां बार-बार खाते रहते हैं, हमारे जो बॉडी के पेन रिसेप्टर्स है वो बढ़ जाते हैं, तो हम एज सच इस मेडिकेशन पे डिपेंड हो जाते हैं, इवन दो इट इज समथिंग एज सिंपल एज पैरासिटामोल. और फिर वो वो लो तो भी हेडेक होता ही रहता है, और बंद करने की कोशिश करो तो हेडेक बढ़ जाता है. तो दैट इज अगेन अ वेरी डिफिकल्ट कंडीशन फॉर द सफरर. तो इतना लंबा इसलिए हमने मेडिसिन लेने नहीं चाहिए. What is the most common cause of headache? Mr. Shailesh has asked. So most common cause would be a primary tension headache. उसे ऑफिस हेडेक भी कहा जाता है. डेली जो हम सुबह उठ के ट्रैवल करते हैं, ट्रैफिक, हीट, डिहाइड्रेशन, लैक ऑफ स्लीप, स्ट्रेस, ये सब मिलके हेडेक कॉज करते हैं. एंड दीज आर द कॉमनेस्ट कॉज ऑफ हेडेक्स. एंड इनको ट्रीट करना इज द इनको अवॉइड करना, इन चीज़ों को थोड़ा रात को स्क्रीन्स अवॉइड करना, to get good sleep are the first points to avoid these daily headaches. Kiran Kumbhar has asked, can overthinking affect, can cause headache? So yeah, that is a type of stress. When you do overthinking, उससे stress बढ़ता है और उससे बिल्कुल headache हो ही सकता है.
Summarize now.
Yes, I think you can summarize.
Yeah, so I think what have we learned from this session today? The first lesson is that even spiritual leaders like Sadhguruji can have sinister causes of his headache, and not spirituality but surgery is what can save lives of such people. Second, we know कि कौन सा headache बेनाइन होता है. बेनाइन मतलब उसका कोई खतरनाक कारण नहीं होता है, और कौन से हेडेक से आपने संभल के रहना चाहिए और आपने तुरंत डॉक्टर को दिखाना चाहिए. मैंने बोला हेडेक्स मॉर्निंग में होता है तो हेडेक आपको विजुअल सिम्टम्स पैदा करता है, तो हाथ पैर में तकलीफ करता है, तो जबान लड़खड़ाती होगी. तो 50 साल के ऊपर के लोगों को हेडेक फर्स्ट टाइम होता है. आपका हेडेक का पैटर्न बदल जाता है, कोई नया किस्म का हेडेक अचानक. पहले माइग्रेन था, ऐसा तो कहीं लिखा नहीं है कि माइग्रेन वाले पेशेंट को ब्रेन ट्यूमर नहीं हो सकती है. तो माइग्रेन है करके आप लेते रहेंगे तो दैट कैन delay the diagnosis, and a condition which is previously treatable may now become untreatable. So these are the things, and the final word of advice is कि over the counter केमिस्ट से पेन किलर्स लेके अपना सर दर्द ऐसे ही ढकेलते मत रहिए. If it is happening again and again, do visit an expert near your house and take consultation, and if required, get an appropriate CT scan or MRI done for a diagnosis to be made. And most of the causes, even if they are secondary, are treatable by modern surgical therapies.
To end, I would just like to say that now that it is धूप का season है, it is summer time, lot of us forget to drink water. अभी बहुत गर्मी हो रही है और हम पानी नहीं पीते, उसके वजह से हमको headaches भी हो सकते हैं, and that can eventually lead, that is an early sign of having a heat stroke, as Dr. Mahesh has asked in the Facebook comments. So we need to remember कि पानी पीते रहना है दिन भर. कभी कभी ये ना पियो तो ब्लड क्लॉट्स हो जाते हैं ब्रेन में, एंड दैट कैन लीड टू अ वेरी बिग प्रॉब्लम लेटर. सो वी नीड टू ड्रिंक अ लॉट ऑफ वाटर एंड हाइड्रेट दिस समर. थैंक यू एवरीवन.
Thank you so much
फॉर लिसनिंग.